Hi there. Happy Friday, everybody. Weekend is almost here. I think I look forward to it more now than I used to a few months ago. Let's see. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our daily update or overview over the impact of pandemic COVID-19 on Mobile, Alabama, and our residents. So worldwide, we're just past 7.5 million cases of COVID-19, with 2 million of those, a little over 2 million, occurring in the United States. Worldwide, there are around 423,000 deaths, with again a quarter of those occurring in the U.S., 114,000 deaths from COVID-19 disease in the United States. In Mobile County residents today, our report came out a little bit later today because there was another small glitch with the statewide surveillance system last night, but it's been corrected. So today we're reporting on 2,643 cases of COVID-19 in Mobile County residents. 2,624 of those are laboratory confirmed COVID-19, and 19 of them, or less than 1%, are probable cases. And remember, a probable case of COVID means that a patient had symptoms, had known exposure to a laboratory confirmed case, but did not have a laboratory result themselves. And then we combine those when we track COVID disease. Yesterday, we added 33 new cases to our count, and there was a slight adjustment to the number of cases reported on June 10th. Originally, it was reported as 51 cases, but as our investigators got in there and looked at things and cleaned some things up, that number has been reduced slightly to 46. We didn't have any new hospitalizations from yesterday, so that's really good news, holding steady at 260 or 10%. Unfortunately, we have added one death to our case count, bringing the number of deaths from COVID-19 to 129. And again, we are reporting on daily just on the number of cases that are reported by day, and there is going to be quite a bit of fluctuation in that date because, again, that report date is influenced by so many things that have nothing to do with the natural biology of the disease or of the spread of the disease. So things like what day you got your specimen collection, was it delivered to the lab, or did it have to go, FedEx to the labs? Was there a queue or a backlog at the laboratory for results? When did the result test electronically get back to us, or did it have to be mailed in? So there are a lot of things that affect the laboratory report date. But very early in this event, that was what we started doing, and that's what we're sort of stuck with. So on Sunday, when the week's cases have closed out, remember, a week's worth of data runs through from a Sunday through a Saturday. Then on Sunday, I compile the much more detailed report to make that available to you, and we'll have a better idea about what trends look like when we look at things like the number of reports by week or the number of cases by event date. We look at rolling averages, those sorts of things to give us projections, to give us an idea about where we're going. I do want to comment, and we had a question from the media for today asking if I could give an update on hospitalizations. And yes, I'm super happy to report or point out, this is in our report, that hospitalizations have decreased every week since the week of April 26th. So this is really good news, and we're happy about this. We're still unfortunate that we have some people who are very ill and require hospitalized care, but we're really happy to see the number of hospitalizations go down week over week. And I'm going to try to provide some more context on those, like duration of illness and that sort of thing next week. Also, the number of deaths reported each week have gone down or stayed the same or gone down since the week of starting May 3rd. So that is also very good news. I think there are several things that affect this. One is, early on when we had outbreaks in 6 or 7 or 8 of our nursing homes. Those outbreaks greatly contributed to the number of hospitalizations and deaths. About 60% of our deaths were associated with those long-term care facility outbreaks. The long-term care facilities are getting a handle, are recovering from those outbreaks, coming out of the outbreak status, we hope, in a few weeks. And the testing is more readily available now, and the nursing homes are able to quickly detect infections in their communities and their facilities and make decisions based on that really important data, that laboratory result. We didn't have that available to us back in late March and early April, when it would take several weeks sometimes to get a laboratory result back. So we're hopeful that our numbers will continue to stay low with regard to COVID cases that are hospitalized or who have died. You might have seen an announcement from the Alabama Department of Public Health expressing sympathy over the loss of an infant and a teenager to COVID-19 disease. We too are very sad to hear about those unfortunate events. Their investigations are ongoing to determine if they had underlying health conditions, but it emphasizes the importance of all of us taking the necessary precautions to protect ourselves from COVID-19 disease. Surely, most of us who are healthy and young will be able to, fight off the virus and have relatively simple, uncomplicated, disease course, but there are still people out there who are extremely vulnerable to severe complications and deaths. And you just never know when you're standing in a grocery line or waiting on a curbside delivery, if the person next to you or in front of you has underlying conditions that might make them experience severe disease if they catch COVID. So that's why we're still asking people to please do your part in the community by wearing your face mask when you're out in public to protect yourself, but mostly to protect those that are around you. Again, you wearing it, you're going to keep your hands out of your face, and that's going to protect you. But mostly wearing this face covering is to keep your germs from landing where other people can pick them up. So let's see, here is another question. How do I feel about children wearing face masks, for a significant part of the day? We are not recommending children 2 or less wear a face covering. Certainly, we don't want to make it difficult for young children to breathe, or we don't want to restrict their oxygen intake. I think that we have to be very careful with small children that we ask to wear a face mask, because they need to be worn properly. You should remove them when they're soiled. You really should wash them, and so it's sometimes difficult for a child to handle all of those instructions. So they rely on their caregivers and their parents to help them recognize when is the most important time that you need to be wearing a mask, and that is when you're out in public. So if you're around your immediate family, if the children are outside playing with just the other children in their household, they would not need to wear a mask. But certainly if you are in a setting where you are around other children, we would like for them to wear a mask if they can tolerate it and maintain that 6-foot distance to further protect them from catching germs. Let's see, here's someone in a different county, but we'll address this question anyway, who says their employer, they have been told or they've heard that their employer, that there are employees, at a business with COVID positive employees and residents. So maybe it's a home. The director didn't test all, only some. What's next to do? So these are very challenging conversations, and we have conversations with businesses like this all day, every day. So call public health and talk to them about recommendations. If there is COVID in a facility, it really, the decision about how to manage that really depends on the things that are specific to that facility. So was it an isolated area that can just be cordoned off and disinfected? To what extent are you using those social distancing? How long has it been since the positive resident or employee has been in the facility? And these are very complex issues to think about and talk through, and there are tons of instructions out there. It's very easy to get overwhelmed and confused. So call us and we'll be happy to walk through that with you. Again, the business owner needs to call us because we need to get primary source information in order to give good advice. And then the last question here is about the accuracy of test kits being used. PCR tests are very accurate and they are available anywhere. If you want a test, you can get a PCR test. And then further about antibody test kits, do we have any idea about the margin of error from those kits? And we do not have concrete information on the accuracy of antibody tests, and we don't recommend you use those for diagnostic purposes or for any purpose at this time until our federal partners and researchers, academic centers learn more about that. And if we have just 1 or 2 more minutes left, I just wanted to clarify one thing in the amended Safer at Home order. The Safer at Home order specifies for child care facilities that each employee shall wear a mask or other facial covering that covers his or her nostrils and mouth at all times while in regular interaction with students or guests. I may have created some confusion here previously by not emphasizing that face coverings are required for workers in child care settings. So with that, I will wish you a good weekend, and we'll see you Monday to give you another update on COVID pandemic affecting Mobile.